fourth in a series of neurology or neuroanatomy lectures for YouTube. Today I'm going to talk about head trauma and also going into the areas that may be involved with the brain bleeds, the epidural, subdural, and intracerebral hemorrhages. To know about where these locations are, you first have to know about the meningeal layers. And the layers, the three layers briefly, are arachnoid, subarachnoid, and the dura layers. And then we'll talk about intracranial bleeds. And these can occur from an aneurysm, from strokes, from trauma. The meningeal layers are three that surround the brain, the spinal cord, extend all the way down from the brain to the spinal cord. And they lay in sequential orders, the first being the dura mater, the second the arachnoid mater, and the third is the pia mater. And those are named, I'm not sure which language, quite honestly. Dura is the most durable. Mater means actually mother, and pia means tender mother. I'll show you those different layers here. But let's do a scenario. Okay, you're 2 weeks after coming to college, you develop a headache, high fever, and a stiff neck. In the emergency room, you're told that you have an inflammation and infection of the meninges. What kind of a name would you give that? Would it be meningosis or meningitis? So correct, itis, anything with the ending of itis is a term for inflammation. So this describes an inflammation of the meninges. This is a cadaver specimen showing the dura pulled back by the forceps. And underneath it actually is the inflammation. And you'll see the actual pus, the green fluid here is the infection. This is an extremely contagious infection. And the story I always tell is during residency, many years ago, when we would do mouth-to-mouth resuscitation, we had a pediatric resident who did mouth-to-mouth resuscitation on a child who was admitted with symptoms of meningitis, but nobody knew it at the time. At any rate, the child died and everybody went to bed, and the next morning they couldn't find the pediatric resident, and they finally found her in the call room, and she was dead, had died from meningitis, very infectious and quite deadly. So back to the layers. This is a cross section showing the different layers: the skull, the dura, the arachnoid mater, and the pia mater. I wrote these, I put in these images to help you remember these different layers. The dura, as shown by this Duracell battery, is the most durable layer. It was the one that was being retracted back with these forceps. The next layer is the arachnoid. Arachnoid, other name is for spider. So it kind of a web-like structure, forms a web between the dura and the pia mater. And within these two layers is flowing the cerebrospinal fluid. And then the very thinnest layer, the one you'll never see, and you really wouldn't see the arachnoid much either if you were doing a cadaver specimen, but the pia mater particularly is a single layer that covers the cells of the brain and spinal cord. So mentioned that between the pia mater and the arachnoid flows the cerebrospinal fluid. And this is a sagittal view showing the blue representing the cerebrospinal fluid, and the containers and the pathways, what we're going to talk about next, how the fluid how the cerebrospinal fluid flows through the brain and from the brain all the way down the spinal cord and back again. So it's always circulating. Anterior view, the containers, if you were just to look at the containers, taking away all the brain, you have the lateral ventricles here in green, and then the foramina of Monroe, the third ventricle, another container, and then finally the fourth ventricle, and the aqueduct or the canal that goes between the third and fourth ventricles. And then this is going on down to the spinal cord, surrounding the spinal cord. This is a lateral view, looking at the containers. So just to show you some of these structures of the cerebrospinal fluid, the choroid plexus are these grouping of cells that actually secrete cerebrospinal fluid within, and you'll see them in the different parts of the ventricles. Particularly the third ventricle will secrete quite a bit of CSF. The cisterna magna is the area where the opening where the CSF moves out of the ventricles into the subarachnoid space. So there's a third and a fourth ventricle. Where are the first and second ventricles? So this is the third ventricle. This is the fourth ventricle. So where is the first and second? Basically, it's the lateral ventricles, call them lateral ventricles, but basically they're the first and second. And this is looking as a frontal view of the brain, showing the ventricles, the left and right lateral ventricles. The purpose of cerebrospinal fluid, there's probably a lot more than have been included here, but if you've answered all are correct, it does provide a nice waterbed for the brain. So as your brain is sloshing around up there, you pop your head, it protects your brain tissue. It also cleans up all the metabolic waste, and it provides immunity. It protects the brain and spinal cord against invasion. So the answer, all are correct. What is most interesting over the last few years is finding out what sleep is so incredibly important about. It's during this period of time, during sleep, particularly during this really, really deep sleep called NREM, non-REM, or deep, deep sleep, that your brain cells actually shrink, allowing spinal fluid to flow between cells within the brain. And then these glial cells and ependymal cells in the cerebrospinal fluid pick up the toxins, and the ependymal cells actually are sweeper cells, and they sweep them, continually moving the cerebrospinal fluid as it gets dumped into a venous sinus, and then that venous blood is taken to the liver and kidneys, where are your detox centers for detoxification and waste removal. All right, so now you know all the layers of the meninges and the cerebrospinal fluid. Now let's talk about what happens with traumas. This is a story of a man who falls out of the back of a moving truck. He's got a severe scalp laceration. He's taken to the operating room because of the need to clean this very deep wound. And debridement or debridement, if you say it, you can say it either way, is the act of actual cleanup. And then he has stitches placed. What are you going to watch out for after treating the scalp wound? This is the instance where you have to start worrying about intracranial bleeds. So you might have sewn up the scalp, but there might be this bleeding that goes on beneath the cranium. The problem with the brain is it can expand if there's bleeding going on, but it has no place to expand because the cranium does such a tremendous job with protection. So that's a case, and I'll go back. This is a case of an epidural hematoma. This is associated with trauma. Trauma is when trauma and epidural hematoma is when this skull is fractured, and you can usually, as this is a arterial bleed, and it gets very rapidly, they can develop an epidural hematoma and cause brain swelling. Okay, so the next case scenario. Now you have an elderly man. He falls just a very short distance and he bumps his head. There's no bleeding. There's no active bleeding. He's not even taken in the emergency room. Now, is he at risk for brain injury? All right, so actually, yes, he is also at risk. The one on the left, this is the trauma. This is associated with a skull fracture. Epidural hematoma is happening above the dura layer. Subdural happens beneath the dura. And these are very minimal trauma. It's very slow. It can come hours to days. And this minimal trauma is more associated with people that may have atrophic brain matter. So this is brain atrophy, a CT scan showing a normal brain, showing the difference, the spatial difference between the brain matter and the skull. So why are the elderly so at risk? The brain, as it tends to shrink, still has these bridging veins between between the brain matter and the dura. So these bridging veins are stretched, and then it just doesn't take much of having a little bit of brain trauma. The brain gets sloshed around a little bit, and one of these bridging vessels break. All right. So with that in mind, take a look at this image showing a normal 43-year-old normal brain and the brain of a person with alcoholism, 43 years old. Notice how the brain shrinks up dramatically with chronic alcoholism. So this woman presents with sudden confusion, inability to walk, and nausea and vomiting. What are the possible reasons for her symptoms? Alcohol withdrawal, thiamine deficiency, subdural hematoma, or all are possible. And the answer is all are possible, actually. Alcohol half-life, like 4 to 6 hours. So she could be in alcohol withdrawal causing the confusion, restlessness, thiamine deficiency. Wernicke-Korsakoff syndrome can cause confusion. And then, of course, the subdural hematoma. So this is another visual looking at a brain and taking the skull away. And these are the bridging vessels connecting the brain coming through into the cranium. What alcohol does is it affects both balance and coordination. So there can be a confusion if patients with alcoholism present. So basically, never write off a change in mental status to just the alcoholism. They could have a subdural hematoma. Besides, they also have a loss of balance, so they are more at risk for falling, and you might not see any bleeds on their skull or their skin. And then the other problem with alcoholism is with alcoholic liver disease or cirrhosis, end-stage cirrhosis, there can be a loss of the coagulation factors. Again, the brain is great at the skull, the cranium is great at protecting the brain, but it doesn't allow for swelling. So here's an example of how a hematoma develops, starts pushing on the brain because it can't push outwards, and it starts to push this matter over. And this is called ventricular shift. Here's the lateral ventricles, the third ventricle, and everything is being shifted to the side. And the only way it has to go is down through the only opening, the foramen magnum. So the sequence of events, the cerebrospinal fluid is not able to adjust to overwhelming pressure. The ventricles shift, and then it's called herniation, where part of the brain matter starts pushing down into the brain stem. And the death is from the brain stem, the blood supply being cut off to the brain stem. Do you remember what the brain stem does? Remember, it's the heart beating and breathing. So the heart will stop. The treatment of either an epidural or a subdural hematoma is to reduce the brain swelling. You can do that immediately with giving high-dose steroids. If they're unconscious, and even if they're not, if they're very confused, you can have them go under general anesthetic and intubate them and hyperventilate them. Driving the CO2 down, entitled CO2 in their blood, will also shrink the brain tissue. And then, of course, in the operating room, the evacuation of the hematoma. And if they happen to have an aneurysm, then you need to stop that source of bleeding. And this image is showing the skull. It's right here, opened. This is the dura. And this is the hematoma and suction. So next case scenario, this is a 45-year-old man who comes in complaining the worst headache of his life. I should say he wasn't coming. Pretend that he's at his office. He's sitting over his desk and he's just complaining of the worst headache. And he's found dead at his desk 2 hours later. What is your diagnosis? This is an example of an intracranial hemorrhage. This happens most commonly from an aneurysm rupture. You can also see it with trauma. If someone has bad coagulations, like low platelets, very, very low platelets, they can start bleeding intracranially, but usually the most common cause of an intracranial hemorrhage is from an aneurysm. The aneurysms usually form at this great place, the circle of Willis. The circle of Willis, this is the base of the brain, but it's where all of these major arteries come together, and they have all these branches. And it's beautiful. It's a beautiful system because it has a backup supply. It's coming from vertebral arteries and also from carotid arteries. And so if you happen to get an obstruction, occlusion in one of those arteries, you've got 3 other arteries that continue to provide oxygenated blood to the brain tissue. So it's got all these backup systems. The only problem with this system is that at every division, at every split, you get this weakened area. And so with high blood pressure, with weakened areas, you can get ballooning of those walls. And then with pressure, you can actually break those vessels. So the pros, you've got a backup system, the circle of Willis, and the cons, You got weakness. Treatment for aneurysms. The old way, and the way if it's completely ruptured, is to go in and put a clip across the aneurysm through an open craniotomy. That's in the OR, or the operating room. And the other form that's more common now is in the radiology suite, where you actually thread coil up, put it into the aneurysm. Of course, this has to be a situation where the aneurysm is not actually ruptured. And then that coil goes in and obstructs that aneurysm so that it takes away the risk of rupture. All right, so this is an example. This is actually a patient I had, came in to the emergency room. And the story was that he was found lying down at the entrance to the restaurant. He was confused, he couldn't speak, he couldn't walk, and he kind of had a mild headache, but that wasn't his major complaint. So what is his diagnosis? No head trauma. Well, this is the other type of brain bleed. This is from a stroke, and strokes can be two different varieties. The first, embolic clot or a plaque, like a blood clot in the, say a blood clot in the left atrium, can break loose and go up into the brain and occlude the blood supply to all the tissue that's distal to that obstruction site. It could be a large particle, it could be a piece of plaque from the carotid artery. And then, of course, the other type of bleed is a hemorrhagic stroke, where a blood vessel ruptures and there's bleeding into the tissue. So these are two different types of brain stroke. Now, the story on him was that he came to the radiology suite, and it turned out to be a clot, a blood clot, which probably broke off from his left atrium. Maybe he had a moment of atrial fibrillation. He formed some clot in a portion of his left atrium. The radiologist took out the clot, and then at the end of the procedure, the patient woke up completely and told us his story and was exceedingly grateful. And this can only happen if the patient gets care within a very short time after having symptoms. So this is also what can happen, an embolic stroke. A blood clot can form on plaque. So either a piece of plaque or a blood clot that formed at that clot plaque could break off. This is another term, embolus. Embolus is a term to describe an object. So an object could be either a piece of plaque or a blood clot or anything else that's in the bloodstream. For instance, embolus could be if someone was injecting illegal drugs and it had some talc or something that was foreign material that got into the arterial system and went into the brain. So for the guy I was talking about, this is what he had. He had a piece of clot. The radiologist threaded a catheter into the femoral artery and threaded all the way up through the aorta, up into the brain, and found the clot and then removed it through this basket. So to summarize, intracranial hemorrhage can either be epidural. So epi means above, upon. Epidural hematoma upon the dura usually happens with skull fractures, acute trauma. Subdural is below the dura. It's associated with brain atrophy and minor trauma. usually people who have brain atrophy. And then the third is intracerebral hemorrhage within the brain tissue. So that's could with an aneurysm, can happen with trauma or with a stroke. So knowing the specific cause of the injury will help you in watching for any signs that there could be a bleed. And notice that the presenting symptoms are different. Epidural hematoma, it's very quick. Subdural hematoma, it's slow. Patients may not complain of a headache. And then intracranial hemorrhage, if it's a arterial bleed at the circle of Willis, it can be a very quick bleed, and those are the ones that are complaining of the worst headache of their life. And that's the end. If you have any questions, please include them in the chat. And also the PDF will be available attached in under the extra section. Thank you.